Good morning. Welcome to CGI live LinkedIn discussion about the power of connected data for healthcare transformation. I'm Brad Schoffstall, Vice President from CGI Federal Health, and this morning I'm joined with Dr. James Peake and Stephen Sousa, both Senior Vice Presidents at CGI Federal. We are living in just unprecedented times, along with really kind of things going on in our health ecosystem. It's just AI is everywhere, and there's a lot of expectations that AI is going to do all these great things, actually going to do more, much more, for less, and still achieve very high successful outcomes. So it's more important than ever for clients to collaborate with trusted partners that have deep domain experience. So in this case, in the federal domain, it's provider, payer, and beneficiary, but then also have the experience to be able to do end-to-end implementations, enterprise-wide solutions at scale. So there's a lot of opportunities, a lot of challenges. So Dr. Peake, given your varied your career in federal healthcare, please share some of your thoughts on the opportunities and challenges.
Well, I think if you just look around, we're at HIMSS, and you look around this massive showcase, and you see AI everywhere. So I think that the truth is the promise of AI is out there for efficiencies and better clinical outcomes. And I think people really are looking forward to reaping the benefits of that. But the importance of it is really the underlying data that supports it. Access to that data, the quality of that data.
Absolutely. All right, so Steve, you have experience in the commercial side of healthcare and the federal side of healthcare, so please share your insights.
Well, to me, as Dr. Peake alluded to, it's the quality of the data that really drives the capabilities from what AI can actually do, whether it be mobile devices or other things. But that interoperability and connectivity between data sources is really important to be able to talk to each other and interact. I think, as an example for that, I think HIPAA, I know this is a long time ago, but it went a long way with X12N transactions and standardizing some of that data. And now, I think, as a provider in this space, it's important for us to demonstrate the effectiveness in the communication between entities, whether they be federal, commercial, or state and local, to maximize some of the benefits that AI can bring to them.
Right. So with CGI being a global company, we do healthcare in Canada, the UK, Nordics, and so we also create our own software. So we're not just a services firm; we have a lot of software, and that software enables our clients really to take advantage straight away of AI. So we bring that global to federal, and so that's an important aspect too. That just to keep in mind that you want those commercial best practices brought in to the federal market. So we have done some very interesting advanced data sharing in the federal market. And I want to get Dr. Peake's your experience as how connected data has really helped you both treating patients and then also working with back end like the VA or DHA.
I think when we surveyed our clients, most of the implementations were in the back office space, in the efficiencies of the business of medicine, where as I look around and see people really using, as an example, generative AI, is in the ambient scribe, as an example, where they're listening to a conversation between the provider and the patient, synthesizing that in a concise note afterwards that is available for the clinician to review. And I say that deliberately because our philosophy is that there's a human in the loop in terms of responsible AI. So, and I think that is going to be an ongoing important aspect as we continue in this along this AI journey. And I think it is a journey, and we're in the midst of that journey right now.
Right. So we are live at HIMSS, as you can tell. So Steve's thinking of user journey. I've had some experience really on the commercial side, really dealing with people. So just talk about the user journey and how it can be improved across our space.
Well, I think it's the connectiveness between entities. So in addition to the operational efficiencies and administrative efficiencies that you can get, I think it's patient outcomes, right? So as we transform, that time between, a patient and a physician meeting, interacting on a visit, I think that produces and drives those quality outcomes because you're minimizing the time for treatment, for example, as one case.
Right.
The other thing I'd like to piggyback to on some of what you said is, when you're talking about that intersection of health and IT, I mean, we're a 90,000 plus member company,
Right.
and then we've got about 10 to 12,000 of those folks are actually experts at that intersection of health and IT, which is across the globe, and I think an extraordinary benefit for all of our customers in that space.
Right. Well, Steve, given the book of business we have in federal and in the U.S. for many different aspects of healthcare, as far as advanced data sharing, we were able to help in the Medicare space really bring, because the government, the way they procure systems is there's a lot of acquisitions where each system does its own thing with the provider data, and they all have their little silos. And so we were able to help bring all that together, with keeping the data in place, but sharing it really more in a virtualized way.
Yes.
And so that's really had a positive effect. And so can you just talk a little bit about that effect and really how that use case could be applied in so many different areas?
Well, to me, it's the cost savings from an efficiency standpoint to make sure that you're not replicating those same systems, bringing it into a centralized location that it can be utilized. If you're at a civilian agency, you're stopping short of the bed, you're focusing on the administrative costs. But if you're at a military or defense health agency, it passes past the bed to a lot of the telemedicine that you're providing for the patient and care and delivery.
Right. Yeah, so along with having that connected data, you really have an opportunity, Dr. Peake, for process improvement. So can you talk about some things that you see as really ways that processes could be improved, streamlined, really focusing on specific user journeys?
Well, when you think about what we're doing with improper payments as an example, the opportunity to leverage AI to take thousands and thousands of claims, quickly sort them into 18 different buckets, to be able to use generative AI to go and query the record to find the problem or the justification for being able to pay that claim appropriately is a great use case right away.
Right.
And as you look down the road, as that is able to self-learn, it'll get better and better and better. And I think that's one of the key aspects of AI.
Right.
I was thinking, we're here at HIMSS in 2018, Eric Schmidt, who was the former head of Google, talked about the value of being able to amass millions of retinal scans and analyze them, recognize the patterns and associated with pathology, and compared that to what the much smaller number that an individual ophthalmologist might be able to see in his or her practice in a lifetime. And so and there have been a number of studies where, particularly in the imaging world, AI is starting to prove valuable. We're looking at it in Finland as an example, looking at CT scans for identifying non-traumatic brain bleeds, and being able to help the radiologist, again, putting the radiologist, the human in the loop, which is sort of fundamental to our view of where AI is at this point. It's a good example of how we can increase the efficiency of the expert who's already expert.
Absolutely, responsible AI.
Well said. Yeah.
So that's a good example, Finland, because we have a solution there, Omni 360, that has actually integrated hundreds of different health systems into an integrated electronics record system, but also kind of like in a community too. So it's not just the actual providers as far as like medical doctors, it's in-home care, it's any type of community support, and it's all integrated so that user journey really doesn't have to go to all these different places, which kind of is the way it is in the US. If you're a veteran, but you're also on Medicare, it can be quite challenging to not have that streamlined process.
And what you're getting at, though, is that underlying data is important, the ability to share that underlying data, and why the opportunity to review policies about data sharing at individual agencies is going to be an important part of this as we move forward, I think.
So Steve, we have 20 plus years experience implementing policy into systems for Medicare. So can you talk a little bit about our experiences and really what you've seen over the years and what we can do going forward?
Yeah, I think, and the most important thing, even though it's in the federal space, is that connectivity with the state and local community and our commercial brethren, and taking best practices from each of those and kind of maximizing the effectiveness there. For the time that we've been in that space, we've delivered close to 80 or over 80 systems from start to finish. And for those that we've had for a longer period, it's the taking care of those systems with making sure that they're modernized, they've translated into the cloud, and then also making sure they're up to date with all the policy and regulatory changes that happen, particularly in the federal space, as quickly as they do. So, I'm very proud to lead the organization that does that, and the talented folks that make up that group. Again, I think the bigger thing for us is just sort of that impact globally and how we share that and those best practices across the company for our clients.
Absolutely. Yeah, it all starts with the data and bringing that data together. Just think about, something like a claim, like a Medicare claim. If that was available in like one shared data source across SSA, the VA, what would that mean? Just talk about some of the benefits of something like that.
Well, it would offer the opportunity to better manage care, for one thing, but it would give us the opportunity to look and understand outcomes based on the treatment protocol or the business processes that support those treatment protocols. So I think there's tremendous opportunity for with leveraging AI if we can have the ability to use the data. And as you say, it can be federated. It doesn't have to be in a single data lake. But that's where the policy and the data use agreements and so forth need to come in, because fundamentally you do want to remember the importance of privacy in all of this as well.
Right, and that's why we really are proponents of what we call virtualized data environments. So the data lives in this existing system wherever it is, VA, SSA, but we can pull it over with the right tooling to create a virtual environment that can be very large. Given today's clouds and the amazing amount of storage, it can be cached, and then you can have all these different use cases that run on it, and many times the use case is kind of like one-off, and so they do their thing, and then the data could actually kind of go back to its where it lives, or it could be retained for other use cases. But there's so much flexibility in this approach. And so, Steve, I'm just, what could we do if that was actually in place across, our book of business?
Well, I think that you're limited by your imagination,
Yeah.
so I'll leave it with that, because there's a lot you can do.
Yeah.
I think the biggest thing for us is, because we've tried for some time to actually break down some of the silos that exist between entities, I think it's important to not stop trying and make sure that those entities understand and realize the value, and not just from cost efficiencies, but from delivery outcomes. So I think people are more and more open to it as security and aspects of data, privacy and all those things are actively managed and successfully managed. But I think it's our job to keep pushing for that because of the benefits that it produces.
Right. So
I don't know if that answered your question.
No, it does. So when you think about like challenges, we talked about policies. That's a challenge. But being an end-to-end services firm, really, we go from the very beginning, the strategy, all the way to implementation and operations. So we know the importance of change management and actually having adoption occur. So, Dr. Peake, can you talk about, your experience where sometimes you have this great solution, but it's just not adopted?
Well, and that is oftentimes explaining and building trust. But I'll tell you, the other thing is, in line with what you're saying, is we've been with our clients for 30 years. And so we actually understand the cultures, we understand the business processes, we understand the mission, and we're aligned across all of those. And I think that really is an opportunity to help them innovate in ways that these new tools will allow.
And I think that's our job. I mean, you hear you've been a partner for that long. I mean, but we've been a partner for that long because of the value that we continue to bring, which includes modernization, that evolution to that next technology, making sure that the risk aversion is still there, and that the policy and regulations necessary are met on time and on budget. And we've done that across the board, successfully. So,
right. Yeah. So one of the large agencies that we worked with, we helped the CTO implement new technologies into an environment that had a large amount of legacy systems. And so, his approach was, well, I've got to have a business owner who's willing to say that, yes, we'll adopt this. We'll adopt this modernization. And so one example is robotic process automation. So we implemented a very large enterprise scale robotic process automation solution that has had really fantastic impacts on productivity, not actually causing people to actually lose their jobs, but they're able to do more higher level things because these manual tasks are being taken care of by an attended robot. So
well said, yes. And I think if I'm not mistaken, we identified at said agency over 100 use cases, and for the few that we implemented, the savings were magnificent. So again, continuing down that path and helping the agency down that journey is something that we're excited about helping.
Yeah. Brad, just a couple of years ago, you spoke about API Gateway at this very convention, as I recall. Can you talk about how API Gateway fits into what we've been talking about with data and AI?
Absolutely, yeah. So API Gateway really is, when we say virtualized data environment, we're talking about that API Gateway implementation. So it's a managed API layer, so it's governed API layer because you don't want to be able to have somebody just introduce new APIs without that going through the proper vetting. But once they're in place, you have the use cases identified, now you can get the right data efficiently. And so we've also done that virtualized data environment implementation at another large agency too, except that one's a little more challenging because it was integrating mainframe technologies with cloud technologies. So it just doesn't have to already be in the cloud. We can really integrate any system with this pattern. Yeah.
To your point, there's a lot of talk about cloud these days and kind of a resurgence of the interest in getting things on the cloud. Right. And we've had a lot of experiences, I understand, from both cloud, data strategy, and AI.
Yeah, we certainly have. Yeah, so let's talk about some of our programs that, the positive impact that we've had going to the cloud.
We can talk about a lot of that and the fact that all of them have been successful. We've never had a gaffe there, so I'm proud of that. I think we're proud of that.
Absolutely.
The thing, too, that I would cite is, the environment that we're in has become much more of a we thing than a me thing. So it's who we go to market with and who we're bringing along to make sure that the expertise is well represented. And being open to partnership, I think, is important. And for us, I think our Global Alliance partnerships have been an extraordinary multiplier. Going to market with, Google, certainly we have a number of active procurements in our federal space that are based on efficiencies and maximization of outcomes. Amazon, Microsoft, ServiceNow, all the companies that are making a meaningful difference these days, and we're excited to go to market with them.
Right. Yeah. So and all of those different vendors bring skills that we can leverage in our solutions.
Yeah.
We partner very effectively with them.
And co-investing, right? Making sure that the outcome is where it needs to be. So it's it's an exciting time.
One of the things I've been with CGI now more than 15 years, and consistently we've been really agnostic. We have our own software, as you said, but what we focus on is the solution and our customers' needs. And so that your point about the partnerships is an extremely important one.
Yeah, well said. Yeah, yes, agreed.
All right, so we talked about change management, we talked about data. Let's talk a little bit more about user journey. So when you think about user journey and a lot of discussion here at HIMSS still about prior authorization for treatment. I think every citizen has a story about prior authorization, and so that is an area that connected data and AI could really make a big difference. but you got to have the will, the policy change, and the right solution. So when you think about user journey and these ability to deal with prior authorization, just share some of your experiences of how prior authorization process really is ripe for improvement.
Well, I think it becomes a barrier to healthcare in some cases. And so there's a lot of folks that are impacted by prior authorization that is inefficient. So it's the patient who has a delay in healthcare that may be significant in their care journey. It's the physician who is trying to take care of that patient and has to spend hours every week to respond to prior auth denials, as an example. And if that can be made more efficient, there's a lot of value to a lot of people, a lot of different users in this work stream that will benefit.
And so talk about in the Medicare space, just the importance of getting improvements in prior authorization. How could we help with that? What do we see?
I think one of the things is just access to self-management and having our beneficiaries be able to really define their own journeys and their path. Same thing with our provider community. So I think that to me is breaking down the space in between and making that immediacy, that relationship with the system or the benefit that you're trying to get from the application.
Right.
There's a predictive aspect of this that AI brings, and that you can get prediction in clinical outcomes, prediction in administrative outcomes. In other words, is that claim likely to be paid or not paid on the provider side, or is that outcome on the payer side? Is that outcome going to be supported by the best clinical practice? The clinical practice guidelines is what being authorized actually fit into that. So I think it's bringing the multiple data sets, as you talked about before, Brad, together to be able to answer those kinds of predictive questions.
Absolutely. Yeah, so predictive analytics is an area that really could be applied to so many use cases and really help improve the user journey. So, given kind of what we're doing with CGI investing, over $1 billion in AI, is that
3 years?
Yeah, over 3 years, and across our business unit we have a coordinated AI effort that really is focused on AI, both traditional AI, it's funny we call it traditional AI now, machine learning and natural language processing, and then generative AI on all areas. So, code generation, testing, design, it really can be used in so many different ways, plus fraud prevention, right?
Yeah, absolutely.
Fraud prevention is a huge one.
I alluded to that, but it's funny you talk about how traditional AI has been around. 1940 was when neural networks were first conceived of, implemented in the 50s, and then about 1980 to the early 2000s, the deep learning multiple neural networks. And it wasn't really until November of 2022 that the ChatGPT came about, that had been worked on since about 2017, I guess, and that kind of opened AI to the masses, to non-technical people like me, So I think we are at a relatively early stage in what has been a long journey, but a long way to go yet.
And talk a little bit about how we can really help prevent fraud.
I'll focus on the AI aspect really quickly and some of the stuff that we're doing, and fraud could certainly be one of those topics. But I think one of the things that our emerging tech folks have come up with, I know that we've got our innovation lab focused on health and technology, but we're actually federating innovation with the innovation pods across all of our different areas within our space. Mm-hmm. So AI is different for all of our customers, right? And there are different levels and so forth. So we're taking that concept of an innovation pod and really focusing on the problem set or the use case that they want to deliver, and then coming up with a use case and a pilot that could grow into something more beneficial. So I think that that's one way to make those things real at the pace and the speed that the customer's ready to adopt.
Okay. All right, well, I've loved this discussion. I think we're going to start wrapping it up here. So, Dr. Peake,
I would
give your
say
thoughts?
what you really want to do is not go AI for AI hype sake.
Right.
Yeah.
Identify a problem, start small, iterate, and scale.
Yeah, well said.
Perfect. You have any additional?
Nope, that was perfect.
That's a drop the mic moment.
Let's drop
okay.
the mic. We're
All right,
done.
well, thank you for joining us this morning. We've had a whole lot of fun. Hopefully you have too, and I hope you enjoy the conference, and you have a great week.
Thank you, guys.